The heart pumps blood and oxygen around the body and returns waste products to the lungs for removal. Blood enters the heart through the inferior and superior vena cava, which empties oxygen-poor blood from the body into the right atrium, and the blood moves into the right ventricle and through pulmonary arteries into the lungs. After picking up oxygen, the blood travels back to the heart through the left atrium, to the left ventricle, and out to the body's tissues through the aorta. This pathway starts when your sinoatrial, the SA node, creates an excitation signal, and that signal causes the heart's chambers to contract and relax. Okay, how do doctors and nurses read the EKG? The EKG records the heart's electrical signal in the waveform components. The SA node is the heart's pacemaker, which initiates all heartbeats and determines heart rate. After the atria fills with blood, the electrical signal from the SA node spreads over both atria and stimulates the atrial muscles to contract and empty blood into the ventricles. The atria depolarization and atrial contraction or atrial systole are represented by this P wave right here. While both atria pump all the blood into the ventricles, the AV node delays the signal to give time for the ventricles to fill, and this flat PR segment represents the delay time created by the AV node. The AV node sends the signal to the bundle of His, then to the right and left bundle branches and the Purkinje fibers, spreading throughout the ventricular muscles. The signal spreads over ventricular myocardial muscles, resulting in ventricular depolarization followed by ventricular contraction. The ventricular depolarization and systole events are represented by the QRS complex. The atrial repolarization event is also hidden in this complex. During the ST segment, all the ventricular myocardium is depolarized and has positive charges, so there is no potential difference to be recorded. ST segment is an isoelectric region that should be flat with no elevation or depression. The T wave represents ventricular repolarization, and the flat line after the T wave represents the completion of the ventricular repolarization, another isoelectric segment. After this flat segment, the cycle starts over again. The QT interval covers the entire ventricular activity, from the beginning of ventricular depolarization through the plateau phase to the ventricular repolarization completed at the end of the T wave. Okay, let's summarize the main points of the EKG heartbeat cycle. This is the Heart EKG cycle we have just covered. The P wave represents the atria depolarization and contraction. The PR interval represents the time the signal travels from the SA node over the atrium to the AV node. PR segment represents the delay time created by the AV node to give time for the atria to send all blood into the ventricles. QRS represents ventricular depolarization and contraction. The ST segment represents the end of ventricular depolarization and the beginning of ventricular relaxation or repolarization. It is an isoelectric region with no potential difference. It should be flat with no elevation or depression. The T wave represents ventricular repolarization and relaxation. To analyze the patient's rhythm, you should clearly understand the EKG strip paper, which we will review in this section. You are a nurse or a doctor, and you have applied electrode leads to a patient and printed out the result on an EKG strip sheet. You have seen the EKG recording of the patient's heart electrical signal condition. How would you interpret the patient's heart symptoms? Typically, EKG paper is set to a standard speed of 25 millimeters per second and a 10 millimeters per MV voltage. The paper is a grid of squares that can be used to calculate heart rate. The paper has large boxes with sides of 5 millimeters. Each large box has 5 small square boxes horizontally and 5 small square boxes vertically, with a 1 millimeter size for each. Let's zoom in on one large square box to see the details. As you can see here, 5 small square boxes are in the horizontal line and 5 in the vertical line. The vertical line measures the voltage, which is the wave's amplitude. But you need to pay more attention to the horizontal line, which measures the time. In the horizontal direction, each small square box takes 0.04 seconds. We have 5 small boxes in the horizontal line, and 0.04 multiplied by 5 is 0.2 seconds. That means one box is 0.2 seconds. If one large box is 0.2 seconds, what is the time for 5 large boxes? Do the numbers. For 5 large boxes, it is 1 second. Let's apply this time to the actual wave of EKG. Do you see one large box is 0.2 seconds? And here at the bottom, 5 large boxes are 1 second and 25 millimeters. When you see the patient's EKG result, you should be able to interpret what kind of rhythm it is, and you should be able to calculate the patient's heart rate per minute. To analyze the patient's EKG result, we will use the 5-step method. 1. Identify and examine the P wave. 2. Measure the PR interval. 3. Measure the QRS complex. 4. Identify the rhythm. 5. Determine the heart rate. Okay, for a regular rhythm, you first examine the P wave, which represents the atria depolarization. The P wave should be less than 0.12 seconds. Remember, we said one small square box corresponds to 0.04 seconds. So, how many small boxes correspond to 0.12 seconds? Yes, 3 small square boxes. You got that right. The P wave should not be more than 3 small square boxes. PR interval should be between 0.12 seconds and 0.20 seconds, which means it should be between 3 to 5 small square boxes. QRS complex should not exceed 0.12 seconds, and it should not be a fat peak. We want to identify rhythm and calculate the heart rate. The rhythm could be regular, which is a normal heart rate. It could be irregular, which is an abnormal rhythm. And there are different methods to calculate the heart rate. The heart rate for a normal sinus rhythm is 60 to 100 beats per minute. For bradycardia, the heart rate is less than 60 beats per minute, which is slower than normal. For tachycardia, the heart rate is more than 100 beats per minute, which is faster than usual. Let's start the heart rate calculation with the normal rhythm. Here, we have an EKG result. First, we examine the P wave. If you look at it closely, the P wave is upright and round-shaped and occurs at the same location in the strip paper. Second, we select 2 consecutive R waves and check if there are the same number of large square boxes between R waves. In this case, 4 large square boxes exist between all consecutive QRS waves. This means we have a regular rhythm with normal P waves and QRS complexes. For a regular rhythm, this formula is used. The heart rate equals 300 divided by number of large boxes between the 2 consecutive R waves. We have 4 boxes between R waves. Heart rate is equal to 300 divided by 4, which is equal to 75 beats per minute. How did we come up with this 300 magic number? I will show you where this number came from. Earlier, we said that one large box corresponds to 0.2 seconds, and one small square box corresponds to 0.04 seconds. So 300 large square boxes multiplied by 0.2 seconds equals 60 seconds, which is 1 minute. And remember, we want to calculate beats per minute, which is the rate. So, if you use the large boxes for your calculation, the 300 number should be in your formula. Instead of the large boxes, you can count the small square boxes, which are more precise. So 1,500 small square boxes multiplied by 0.04 seconds equals 60 seconds, which is 1 minute. So, instead of the 300 number, 1,500 will be in your formula. This is the normal rhythm formula. The rate equals 300 divided by the number of large square boxes between two consecutive QRS complex waves. If it is an abnormal rhythm, the heart rate equals the number of our waves in 30 large square boxes multiplied by 10. Now, let's calculate an irregular heart rhythm. When the number of large boxes between consecutive R waves is inconsistent, we use the 6-second method. Remember, we said 5 large boxes correspond to 1 second. Therefore, 30 large boxes must correspond to 6 seconds. We count 30 large boxes on the strip paper and mark the first and last boxes. Then, we count how many QRS complexes fall within the 30 large square boxes. For this case, we have 8 R waves within the 30 large boxes. So, to calculate the heart rate for this abnormal rhythm, the heart rate equals 8 times 10, which is 80 beats per minute. Count the number of R waves in the 30 large boxes, multiply by 10, and get the heart rate.